Okay, so I see you're coming in with some right-sided buttock pain that's been getting worse when you're slouching or sitting for long times, or maybe like bending down and touch your toes. Is that correct?
Mm-hmm.
Gotcha. Okay, so I'm just gonna do some testing today. I just want to figure out what's going on with you. Okay, so first just turn around. I'm just gonna look around, see if, do you mind if I touch? Right about here?
No.
Cool. So I'm gonna observe. I don't see anything right now, but palpation. First, I'm gonna get on PSIS, good under PSIS. So I feel right PSIS is a little bit elevated from the left. So I'm thinking right ilium is kind of living anterior. I'm gonna get on sacral base. Right sacral base is kind of popping into my hand. So I'm thinking right SI possible unlocking. How about in here? Is this tender?
Yeah.
Right in here? Compared to this side?
Yeah.
Right side worse?
Yep.
Gotcha, okay. And then what about in here?
That's tender.
Compared to in here?
Yeah.
Gotcha. Okay. So I'm seeing right SI unlocking, possible right ilium living anterior. With some hypertonicity in the buttocks region. What about down here? In here versus
Yeah,
in
it's
here?
a bit tender.
In here?
Yeah.
Gotcha. Okay. So, first, can I see you bend down, touch your toes? Getting some pain with that?
Yeah.
Okay. What about stepping with your left foot?
No.
That's all right?
Yeah.
What about with your right?
It hurts.
Gotcha. And then if you cross your arms, what if you turn to the left?
No, it's fine.
Okay. And then what about to the right?
It hurts.
Gotcha. So this is all confirming my idea of right SI unlocking with the right ilium anterior fixation. So now I'm going to go into some local muscle testing. So can you just lay on your back for me? So I'm going to touch right on your hips here. Get on the ASIS. Dig down and I'm going to space. You see how I just spread apart? You want to think about trying to bring my thumbs together. Okay, just relax. One more time, and go. Okay, so I feel like the bigger muscles kind of turning on, so I think they're just taking over for the little muscles job. Okay, flip onto your back. Actually, tuck one more muscle on your back. So I'm gonna come right on the spine, right off the spine. So now with this right leg, imagine there's 1,000 pounds on this right leg. So you're trying to lift it up, but you can't get it up. And go. Okay, relax one more time. Okay, erector spine is jumping on immediately. Now let's try this other leg, same thing, 1,000 pounds. And one more time. Okay, feel erectors pop on. So same thing, I think those bigger muscles are kind of taking over for those little muscles. All right, can we stand back up here? So now with that painful motion, with that, you got stepping with your right, correct?
Mm-hmm.
Okay, so I'm gonna just put my hand on your stomach and your back, and to see if any of this helps.
Okay.
Okay, so step forward a tiny bit, excuse me. I'm gonna place here, right below belly button. And light hug and lift, and go. How's that?
A little better.
Okay, and a little bit more, and go. How was that?
A little better.
Gotcha, I'm gonna try a couple other things here. You got on right PSIS, right sacral base, P to A on the sacral base, and I'm gonna posteriorly rotate, and go.
Yeah, that helped.
That helps a lot?
Yeah.
Gotcha. Now I'm going to compress and posteriorly rotate both and go.
Yeah, that helped.
Helped?
Yeah.
Perfect. Okay. Now I'm going to do one more test. So basically, I'm just going to ask. First, I'm going to have my hand on this right side here. Right PSIS, right sacral base. I'm going to ask that you lift your left leg up below 90 degrees. Okay. So I feel that right sacral base popping into my hand. So I'm thinking a right SI unlocking. Now I'm going to switch over to left PSIS. Left sacral base. And I'm going to ask that you pick your leg up above 90 degrees this time. Gotcha, you can come back down. So on this left side, it should be moving when you lift it above 90 degrees, but right now it's not. So I'm thinking about a little SI hypomobility. Okay, you can lay back on your back. I'm gonna do some accessory testing, so I'm gonna slide my hand right underneath you, right under here.
Okay.
You okay with that?
Yeah.
Okay. So right now I'm testing this one. S2, and S3. Feels okay?
Yeah.
So they don't seem to be moving very much, and they should move at least a little bit. So it's playing into my idea before about the like hypomobility. So I'm just gonna stand right here. Gonna do the exact same thing. I'm just gonna be pressing a little bit harder. I'm gonna try and mobilize it here. Mobilizing S2. Feels okay still?
Yeah.
Cool. Alright. So now I'm going to retest this one. Alright, it's still not moving too much. So because of, on this right side, we have hypertonic ischiococcygeus, and on the left side, hypertonic piriformis psoas and paraspinal muscles. They're just scientific names for some big muscles, and they're all a little bit tight on you. So, because of that, mobilization didn't help. I'm gonna do one other thing. It's called manipulation. It's basically just like a quick stretch. So I'm just gonna bring your leg slightly over. I'm gonna kind of pull on it a little bit. You're just gonna feel a stretch. Shouldn't be any pain. You okay with that?
Okay.
Perfect. So, I'm just going to ask you to have your hands there, and you're just going to keep this leg bent, and have your tongue on the roof of your mouth for me. So I'm going to bring you into adduction, and then internal rotation, closed back position for the SI, pre-manipulation hold, come into a stretch here. Any pain with this?
No.
Okay. Alright. Stretch, stretch, stretch. How about now?
No.
Okay, I'm about to have a quick stretch. Just relax. Any pain there?
No.
Feels okay?
Yeah.
Perfect.